Renogram in assessing the renal function. The best treatment investigation modality for the children with the CKD is the doing one renogram, the diuretic renogram, the captopril induced renogram. So creatinine is fallacious in understanding the renal impairment, because 50% of the nephron loss must be there to have the raised creatinine, and it has variations in the food intake, your protein intake, has higher amount of creatinine, and wasted person with less muscle mass has less creatinine. It's not reflecting the renal function, and below 2 years it reflects the maternal level, so don't have the real creatinine. There are plenty of other issues at the neonatal period. They are not good replica of your renal impairment. So thereby, the your in DTPA, and then MAC3 and your DMSA, these renograms, they are very much useful in understanding the renal function, at least in chronic cases. Acute cases, they are not practiced throughout the globe, but chronic cases, they are very informative and useful. Why? The DTPA is a glomerular agent, principally excreted through the glomerulus, gives good idea about the glomerular function. We know the Renogram is a tracer injection and the radiotracer injection, and while the dye passes through the kidney, you have vascular phase, and when it passes to the parenchyma cortex, you have cortical or parenchymal phase. When it is eliminated through the pelvis, you have excretory phase. So it reveals the site of lesion, site of involvement, causing renal impairment, and similarly MAC3 is a tubular agent. It reveals the tubular excretory function well, and the less elimination of the radio tracer while it passes to the pelvis. It gives a good idea of the excretory function, obstructive uropathy. So the parenchymal disease, obstructive elements, and your vascular pool issues, they are better revealed by the your DTPA, MAC3, and DMSA renogram. The DMSA, apart from that, detects the scar. So the DMSA is not that good for the excretory function, but other two are good in understanding the obstructive uropathy. So you push a dye, wait for a few minutes and hours, and while it passes, when it starts passing through the kidney, it comes by 5 minutes into the your pelvis and comes in the urine. So you know where is the lesion like, and it is a chronic kidney impairment assessment, good for the it is that CKD assessment, and it is non-invasive. The DTPA, the DMSA, and MAC3, these two tells the differential functions also. It detects the ectopic tissue. It detects kakut, and the DMSA detects the scar, total kidney function, size of the kidney, as you see in CKD, acute pyelonephritis. In acute pyelonephritis, what does the DMSA says? It's inflamed kidney, swollen kidney. You are more diffuse photopenic area. You say it detects acute diagnosis with acute pyelonephritis. When you have sequelae at 4 to 6 months after, while you do it, you see there is a scar. So these are the two interpretations in the acute pyelonephritis and obstructive uropathy. In differential function, one kidney usually has 50% function. It can be 50 plus minus 6 on either side. When it is more than that, you have decreased function on the one kidney. So less than 40%, certainly it is on one side, it is an impaired function if you consider the other kidney. So total GFR may be less over here. When it is less than 5 to 10%, you have a kidney which is a source of hypertension and maybe infection. So that kidney needs nephrectomy. So thereby DTPA, DMSA, and then MAC3, these three investigations, Renogram, they tell so many things in the case to definite case management. In the so that should be done in all the cases in chronic settings, and your understanding the obstructive uropathy and your kakut, and thereby the practice of doing this test should be increased in the coming days.